We now turn our attention to the Jomo Kenyatta International Airport, where Ministry of Health officials have just received the first batch of Johnson & Johnson vaccines to help boost the country's battle against COVID-19. Let's listen in.
And only this proportion has been able to take a first and second dose. So it means those populations over 58 who we've prioritized as a key priority group within the country need to come forward and ensure that they get both their first and second dose to ensure that they're protected as we continue navigating this COVID-19 pandemic. Overall, only 9.3% of our estimated 2.6 million persons above 58 years of age have been fully vaccinated. And we would like to continue to appeal to this population group who, and we continue to remind you, are at most at risk of severe disease to come forward and take advantage of the vaccination program and now the increased availability of vaccines that we have. I would like to also urge those who've already received their first dose of AstraZeneca to ensure that they go ahead and get their second dose. We now have enough stocks within the country, and so there should be no hesitancy when it comes to coming to get your second dose of AstraZeneca. Finally, let me remind Kenyans that all vaccines which we are deploying are safe, they are equally effective, and that we should all come forward and get vaccinated with whatever vaccine is available. And it's important we emphasize this. No vaccine is superior compared to another. All the vaccines that we have in the country now, Moderna, AstraZeneca, and Johnson & Johnson, have the ability to prevent you from ending up in an ICU bed. So come forward and receive your vaccine. I would like to take this opportunity to thank all the partners who've made this possible. I'd like to thank Africa CDC, the AVAT team, for making this possible, as well as our partners, WHO, UNICEF, UNECA, Johnson & Johnson, who continue to work with us as we fight the COVID-19 pandemic. I'd also like to extend our appreciation to our healthcare workers who steadily and robustly are running the vaccination program and are continuing to do a good job in that regard. It's important to remember that one of the key weapons we have against the fight of COVID-19 is the vaccine. And in the coming weeks, we've been repeating in every briefing that we've met you, we have enough doses available, so come forward and get your vaccine. Again, to remind you, the COVID-19 restrictions, adherence measures continue to be very important. So it continues to be important for you to mask. It's important for you to continue washing your hands. It's important for you to continue social distancing. Like I said, today we are very excited because this batch is a batch that has been made possible by the Kenyan government. And I'd like to ask some of the partners who've collaborated with us to come and say just a quick word, 2 minutes. I'll start with Tito from AVAT.
And that is coming in from the JKIA. And that is the arrival of the first batch of Johnson & Johnson vaccines, which are intended to help boost the country's battle against COVID-19. Away from